Is the COVID-19 pandemic surging in the United States? Are we being misled by the media and many of our experts? Every day, the media sensationally reports the number of new cases to be increasing exponentially. Notice that the data varies wildly from day to day. But notice that the cumulative number of tests, the black line, is increasing exponentially, while most are negative, the blue line, and very few are positive, the yellow line. Now, on a daily basis, we see that most of the daily tests are negative, the blue line, and that the graph for the positive tests, the yellow line, is almost virtually flat compared with the negatives. In sheer numbers, one cannot say it is surging. There is an important metric that the media fails to report because it is not as sensational as the sheer number of cases. It is the percent of tests that are positive, the infection rate. The infection rate is equal to the positive number of cases divided by the total tests. If we calculate this for the cumulative data, we can get a better picture of the trend and take out the daily noise. Many positives are asymptomatic, while others are less serious and not require hospitalization. This leads to another metric that is very important, and it is the percent of the positive cases that are hospitalized. The hospital cases divided by the total positive tests. Again, if we calculate this for the cumulative data, we can get a better picture of the trend and take out the daily noise. Now let's look at these two metrics for the country and two states where the media is hyping the virus to be surging. This is a graph of the cumulative infection rate, the blue line, and percent positive hospitalized, the purple line, for the country. Overall, the cumulative infection rate, the blue line, for the country has flattened to about 8% of all tests, and the percent that have been hospitalized, the purple line, has reduced from 12% to about 9%. So, what is the percent of all tests that have required hospitalization? It is 12% of the 8% positives. 0.12 times 0.08 equals 0.0096, which is about 1%. This says that 99% of all tests as of July 4 are either negative, asymptomatic, or mild enough that did not require hospitalization. Do these data suggest that the virus is surging? If anything, it appears that it is under control. Now let's look at Texas, one of the states where the media claims the virus is surging. This is a graph of the cumulative infection rate, the blue line, and percent positive hospitalized, the purple line, for Texas. The infection rate, the blue line, is shown to be increasing to just above 9% from its low of about 6.8%. And the trend in percent hospitalized, the purple line, tracks about the same as the infection rate. But notice that the percent of positive that require hospitalization is a low of 4%. This says that 96% of cases are either asymptomatic or are mild, and is 5% lower than the national average of 9%. The percent of all tests that have required hospitalization in Texas is 4% of the 9% positives. 0.04 times 0.09 equals 0.0036, which is less than 0.4%. This says that 99.6% of all tests in Texas as of July 4 are either negative, asymptomatic, or mild enough that did not require hospitalization. This is a graph of the cumulative infection rate, the blue line, and percent positive hospitalized, the purple line, for Florida. Florida's infection rate has increased by 7% since early June, but the percent that have been hospitalized has fallen 10%. This suggests that the majority of increased infections are either asymptomatic or mild, since they did not increase the total hospitalizations. The percent of all tests that have required hospitalization in Florida is 8.5% of the 17.5% positives. 0.085 times 0.175 equals 0.0149, which is less than 1.5%. This says that 98.5% of all tests in Florida as of July 4 are either negative, asymptomatic, or mild enough that did not require hospitalization. Now let's look at what is the most important metric, death, and its trend. Deaths in the U.S. have declined at a rate of about 20 deaths per day since May 1 to a value of about 500 deaths per day by July 1st. Deaths in Texas were about 20 per day on June 1 and have increased by 1.2 deaths per day to about 35 per day by July 1, but overall are about flat. Deaths in Florida are relatively flat, with marginal increase since June 1 to about 40 per day by July 1. What can we conclude from the graphs of infection rate, percent hospitalized, and death rates? First, the infection rate for the country has flattened to an average of 8% of all the tests as of July 4. Second, most persons tested positive, 92% as of July 4, are either asymptomatic or their sickness was mild enough not to require hospitalization. Third, the percent of all tests as of July 4 that are either negative, asymptomatic, or mild enough that they did not require hospitalization are 99% in the country, 99.6% in Texas, and 98.5% in Florida. Fourth, the death rate in the country is declining steeply and is relatively flat in Texas and Florida. And fifth, the COVID-19 virus is not surging in the country, or in Texas, or in Florida, by sheer numbers of the total infections, or the daily infections, or the infection rate as of July 4. What else do governors and local officials need to know for decisions in reopening their economies? Question: what is the degree at which a person who tests positive for COVID-19 can transmit the virus to other persons? Is the degree of transmission of the virus the same for the person who has symptoms, person A, as to one who is asymptomatic, person B? The answer may lie in the volume density of the virus that is expired by person A versus person B. Intuitively, one would expect that the volume density of the virus expired by the symptomatic person to be greater than that for the asymptomatic person, and the volume density of the virus may increase with the degree of sickness of the symptomatic person. It would be important to know this condition for different age groups, for example, 0 to 18 years, 19 to 40 years, 41 to 60 years, 61 to 80 years, and over 80 years. Why do we not hear any news of such research by the CDC or medical research community? This would especially be important in regard to reopening our schools, because the experience in Europe in reopening schools is that children testing positive are mainly asymptomatic and present little risk of transmitting the virus to others. In New York, there have been no measurable increase in infection rate or hospitalizations 2 weeks after the protests by people who are mainly young, under age 30. Does this suggest less risk of infection to or from younger people? Where is there evidence of resurgence of the virus? None. Only an increase in cases because of an exponential increase in testing. States should continue with their plans to reopen their economies. The virus curves have flattened, and the goal to not overwhelm our hospitals has been met. The American people have suffered enough. Thank you for listening.